modified as an ambulance, and it is easy to maintain. You can get the spare parts from everywhere other than a Land Cruiser that you need to transport to Kampala, for example, from Oyam. Okay. All these kilometers, and servicing is in millions, not in hundreds.
Thank you very much, Peter.
I just conclude.
Yeah. I hope your conclusion will be like a second.
Yes. In conclusion, indeed, it is important that we engage the community. They have problems, but they also have solutions to their own problems. And this is where we are.
Okay, thank you very much. I think we've ended it on a very good note. Everyone now is talking about community-owned, community-determined, community-focused needs and solutions. I have seen it everywhere. All the leaders are talking about determining solutions from the community perspective, not prescribing from the top where we are always programming from, but sitting with people. Some people are talking about human-centered design, but it's about really the community that we are talking about. So thank you very much. I hope you have scripted your stories. They can still go in circulation. People can have access to your stories so that we have more and more people accessing them and learning from your experiences. Thank you very much. I hand over to Dr. Eve. Thank you, my producer, for allowing me to have extra time. Yeah. Thank you.
Allow the applause, colleagues, our friends. So it's the whole real people with real needs. Yeah. The president of this country sometimes encourages us, real people with real needs, not imaginary things. We have a great meal at the end of this meeting. I was asked the organizers, is it a snack? I don't want to announce wrong things. They said, no, it's a full course meal. So anyway, friends, look forward to a full course meal. But our leaders in this house, we are going to go for a keynote. And I just want to tell Dr. Miriam in advance that you do the whole wrap up. I know in touch with Jessica, so you'll be able to do both things. Huh? I was just reminding myself about Christ-centeredness, diligence, integrity, servanthood, and stewardship, which are very core values that are right there in front of us. And even as people share, I'm just thinking about what kind of stewards are we? What kind of steward am I with whatever God has entrusted me with? So I think we hear your story, but we hear the kind of stewards that you have been. And I think let those values that we get from Uganda Christian University continue to guide us as we work wherever we go. So it's really my great honor to invite our keynote speaker today. I don't even know how to introduce Dr. Jean Chamberlain, but Dr. Jean Chamberlain, please, you are very welcome to give us your keynote. Oh, sure. Yeah, I think it's right there. Yeah.
Is that one working? Yes, perfect, great. I didn't want to be hiding behind the podium or you would not be able to see me. Well, good afternoon, good evening to each one of you, Save the Mothers alumni, those of you that are online, those of you that are here in person. It is such a joy to be with you. We have anticipated today and we're so excited that each one of you are here and hear all the wonderful things that so many of you are doing. I also want to thank the faculty here at Save the Mothers as well, too. Just listening to Dr. Eve speaking, I have listened to her lectures for years and years, and every time I listen to her speaking, I learn more. So thank you for the faculty that are here. For many of you that are friends that have come today, we're so excited and happy that you're here. Our Save the Mothers board, I thank Honorable Sylvia Sinabulia. It's just so wonderful to see your own alumni taking these wonderful positions. And I remember when Sylvia first came back in 2005, and of course I didn't really understand the educational system here in Uganda. And I remember she was kind of torn because she was trying to get her kids into school. And I thought, February, why are kids going to school in February? Because our system in Canada is so much different. but she persisted and came through, and here she is, the chair of the board. So we're so grateful to her and many of the other board members, Josephine and others. I want to thank the Save the Mothers leadership, Dr. Edward. Again, we've worked together. Edward, I don't want to say it, but it's getting close to 20 years almost. And so it's just been wonderful to work with you. For the UCU leadership, Dr. Miriam. Again, we've worked together, Miriam, for many, many years. And so just grateful to the UCU leadership. And I know the Vice Chancellor sends his greetings as well. I had the privilege of speaking with him yesterday, and he's really very supportive of the Save the Mothers program. I do want to thank Topi and her entire team. A program like today doesn't come together without a lot of work behind the scenes. So Topi, to you and your team, I really want to give you so much thanks. I wanted to add on to Dr. Makosa's comment about the vision of Save the Mothers and the people who so much contributed, and a couple of them that are not with us here today. But as he mentioned, Dr. Marimbi, who I had the privilege of meeting back when I was a young girl. Well, I was not that young, but young enough. And it was what a privilege to have had a lifelong friendship with Dr. Marimbi, Dr. Pius Okong, who again, I just have so much respect for, and Dr. Olive Sintumbi Magisa. Again, these people who've been your lecturers, they've been friends, they've been colleagues, and we're really grateful for them. Well, let me just take it for a few moments. I know people want to get to that food, so I don't want to speak on too long. I wonder if we could put the lights down just a little bit. I don't want people to go asleep, but maybe we could put the lights down a little bit just so we can see the pictures a little bit better. But reimagining safe motherhood post-pandemic. What's our role as Save the Mothers? And the phrase I would love to use is pillar people. Can we be pillar people? And let me talk about that in a little more detail. Well, I'm so glad to see so many of you back. This is just a smattering of some of the classes of the Save the Mothers program. And in fact, some of you may not know, but that building right over there, Mari building, is where we first started the Save the Mothers program, where we first had our classrooms. But for many years now, I think it's up to 19 years now, we've had Save the Mothers graduates, and we're grateful for the new Marimbi building. It's not so new now, but in our own place to actually meet with our students. So again, I'm just so excited to see so many of you here today. Well, what are we going to talk about in the next couple of minutes? Well, just a few things. First of all, just being familiar with the changes that have impacted on Save the Mothers and Safe Motherhood as a result of the pandemic. Just talking about a little bit about players who are advocates to bring change. And finally, just what is our personal role in improving safe motherhood? How do we become pillar people? And we'll talk a little bit more about that. Well, the world is not the same post-pandemic, is it? Lots of things have changed. We see people being very fearful. I know of people who literally still do not come out of their houses in Canada because they're afraid of the pandemic. People that won't socialize with other people, people who have a very hard time accepting any kind of truth. What's really true? They don't believe that anything is true. It's very difficult to give health messages when people don't believe that something is true. So it has really changed the way people think. There's a lot of mistrust, social isolation. We see this with our medical students at McMaster where I work, where students literally haven't been communicating with people. And so they've become very sort of isolated, and it's difficult for them to communicate. We see a lack of community. We see shortages sometimes, and definitely higher costs of everything. And I know that's happened here in Uganda. I was at the supermarket recently, and when they asked how much, they gave me the total at the end, my jaw just hit the floor and see how expensive things were. But again, same thing has happened really around the world. So these are some of the realities of post-pandemic. But having said that, clicker's gonna, I think I may have to, oh there, the world is the same. After the pandemic, the world is actually the same in that mothers still need competent and dignified care. Babies still need attention at delivery, and people still need community. These things are true. Yes, things have changed, but the basic things of life are still very much the same. I just want to go through just very quickly this important slide from Peter Waswa, who's shared it with us. And of course, Peter's been one of our Save the Mothers faculty. the unfinished agenda here in Uganda, and all of us know these numbers so well, the 6,000 mothers dying every year of pregnancy-related complications, the 39,000 babies that die, those that are stillborn, and then finally the children that die or are stunted as a result. This is the agenda that we had before the pandemic, and it's still the same agenda that we have today, isn't it? And as many of us who follow Christ and love Christ, God has given us this agenda. This is our agenda in our lives, is to answer and reach out. We have the skills, we have the training, we have the voice to make an impact on this agenda. But as we do that, we look at this huge agenda and think, where do you even start? Well, first things first is prioritizing safe motherhood. That is really the future of any country, isn't it? Any country that doesn't have safe motherhood, you're going to have children that are going to be impacted. So with all the other strains that are on our system right now, all the things that are pulling our attention, safe motherhood has to be right up at near the top. But how do we make that happen? And of course, that is the challenge. And what a joy to listen to so many of you talking about the programs that you have been involved in to make that happen. Well, I live near Niagara Falls, less than an hour from Niagara Falls, and this is a picture of Niagara Falls. Sorry, again, you can't see it too well, but here's this guy walking along a tightrope across Niagara Falls. Now, some of you have stood beside Niagara Falls. It is an amazing force of water. I've been down on a boat near the bottom there. You can get on this boat and go, and you are just overwhelmed at the power of that force. And here's this guy, Nick Walanda. He trained his whole life. His whole family had been these tightrope walkers. And this guy trained and walked across Niagara Falls on a tightrope. He had to be steady. He had to keep his balance. You know, there's birds pecking at him. If you can imagine that high up, there's birds, there's water blowing on you, there's wind blowing at you. And he had to go the distance. And in many ways, I feel the same for safe motherhood. You know, we're going to have lots of things blowing against us. We're going to have opposition. We're going to have challenges, but we have to go the distance for mothers. Well, I know many of you know this story, but I think just we need to remind ourselves the Millennium Development Goals, which when some of you were first started the program, were in place. The 8 goals, and safe motherhood was goal number 5. We were supposed to reduce maternal mortality by 3/4. And again, we reduced it somewhat, but we didn't meet that goal. And now we've transitioned to the Sustainable Development Goals. And we know that 2 of those goals are related to safe motherhood. But really at the end of it, at 2030, we are supposed to have the global maternal mortality at 70 maternal deaths per 100,000 live births. Now, I don't know about you, but 2030, it sounded like a long ways away. And then Dr. Miriam, I was just calculating. It's 2023 today. We got 7 years to reach this goal of 70 mothers per 100,000 around the world, here in Uganda and around the world. So we have a long way to go, but that is the goal for us. And again, just reminding those sustainable development goals, dealing with much more than just safe motherhood, but many of these goals, as we already talked about, importance of water and safety of water also is involved in the sustainable development goals. Well, let's just back up for a second and think about how has the pandemic changed our approach to safe motherhood? What has been impacted? How do we strategically try to reach this goal of 70 per 100,000? Well, the supply chain has been hit, hasn't it? And this photograph doesn't show up too well, but we know that you have to produce the chemical, then it gets shipped to a place where it then gets put into its form, then it is shipped again, and then you have to send it over to the hospital eventually. So there's all of these different links in the chain, and we could see during the pandemic how one break in that link and the whole thing fell apart, didn't it? We see workforce fatigue. We certainly see this all around the world. I work at a clinic in Canada, and we initially had 9 nurses at the beginning of the pandemic. Do you know how many of those nurses were left at the end of the pandemic? 0. Literally all of our nurses left during the pandemic. Now we get one here, we get one there, try to replace. But my point is people have left in large, large numbers. So we are now dealing with how do we build the workforce again, and not only just grab anybody. Hey, Josephine, will you come and work? Or hey, Dale, will you come and work? No, people who, and you guys would, I know, would be very dedicated workers. My point is we need people who are really dedicated to this, who really understand what it is that they're doing and are qualified to work in safe motherhood. So building up that workforce is very important, people who are really committed to the work. The quality of training is so important. Again, I see this in the medical students coming through. Like again, these poor students don't even know how to talk to a patient, Dr. Edward. Like they just haven't had any social experience. So we need people who are going to be trained well. And this is a real challenge because for several years, we basically have not necessarily been having the quality of training that we were hoping for. General fatigue with health facilities. People are just sort of a little bit tired of going to health facilities and feeling like they aren't getting the care that they need. So again, how do we improve customer service? And I really myself have changed very much how I approach people in the hospital. And, I sort of think about when people come into a restaurant, I always use the example of McDonald's in Canada. People love McDonald's, and every McDonald's you go into, it's a hamburger place. You always know how you're going to be treated. Somebody behind the counter is always going to smile at you. Somebody's going to greet you. And I think, why don't we do that in a healthcare facility instead of just sort of saying, hey, why are you here? It's just, hey, good afternoon. How are you? Thank you for coming today. And I often say that to my patients. Thanks for coming today. Meanwhile, it was actually me that was working to serve them, but thank you for making the time. So again, we have to change even the environment that we have in the healthcare facilities. On a positive side, Dr. Eve had pointed this out before. In some ways, we've got more facilities than we had before. Ventilators that you need to help people breathe. Again, around the world, there's been more ventilators. And you say, well, how does that have anything to do with safe motherhood? Well, actually, we sometimes need ventilators. Sometimes mothers get very, very ill and need to actually be ventilated. So that's good that we now at least have more of those. And we had lots of lessons learned through the pandemic about how best to use our resources. And maybe in safe motherhood, that's something that we need to think a little bit more about, isn't it? Well, we need to understand the changes that are going around us in order to optimize our impact. So the first things first, mothers and babies should not be dying. And that's our role in terms of advocacy and speaking that message. Sometimes when you've got a message that you keep saying over and over and over again, you sometimes get a little bit tired. Does that ever happen to you? Yeah, you sometimes get a little bit tired. But you know what? It's the message that we need to keep sharing. It's like sharing the good news of Jesus. You just got to keep sharing it. You got to keep letting people know. And we need to keep speaking for mothers, because even today, there are how many hundreds of mothers today in Uganda that are delivering, and each one of them today need the care that they deserve and need. And here's my final challenge to you is that we can be pillar people. And what do I mean by this? And Dr. Miriam shared with me a little bit what a pillar means to her. It's about being present. It's about being reliable. When people look at us and say the mothers, do they see people that they can lean on? Do they see people who are going to be trustworthy? Do they see people who know what they're talking about? And you think about a pillar, we even see in this room here, we've got these pillars. If all 4 of these pillars went, the whole roof would come crashing down on us. Now, I don't think there's anybody who walked in here today and looked at those pillars and said, wow, I'm glad those pillars are there. But I tell you, if those pillars weren't there, the roof would be on our heads, right? And so as people who are supporting safe motherhood, we need to be pillar people. We need to be there. People aren't necessarily going to notice us, but our voice and our strength is going to be there supporting the mothers. In the Bible, it talks about James, Peter, and John. They were pillars of the church. And because they were pillars, the church multiplied. And it is what it is today because of these people who were pillars. And may we be the same in our place as well, too. But those pillars have to understand change. There's change going on around us as we hold things up and try to improve things. So I just want to quickly use this model, and some of you may have heard of this before from Jeremy Schiffman, but it really helped me to understand when we're advocating for something, what do we need to understand in a more full manner? Well, he talks about the actor power. He talks about the idea. He talks about a political context and the issue's characteristics. So what do I mean by that? When we think about the actor power, we're talking about the individual strength of the organization concerned with the issue. So in other words, again, sorry, you can't see this so well, but this is an airplane. You remember when that Malaysian plane went down? Everybody paid attention. Remember how much was in the news about the Malaysian plane? For weeks and weeks and weeks, it was the front of the news because everybody was worried. What in the world happened to that plane? And why do we care about that plane? We care because you and I might be on a plane one day and we don't want our plane to go down. We want to find out what happened to that plane and don't let it happen again. So again, it bothered the whole world that this one plane went down. When meanwhile, that very day, the same number of mothers died of pregnancy-related complications, but people didn't really pay that much attention to it. We look at the pandemic. The world paid attention to the pandemic. I don't know how things were here in Uganda, but in Canada, everybody's like, that's a problem over there. And then all of a sudden it came to us. And I can tell you, it really got people's attention then, didn't it? So again, the actual actor, the people that are involved in it. Unfortunately, in Safe Motherhood, we see women, and again, you can't see this very well, but here's a woman holding her bucket. She's got a fistula, right? She had an obstetric complication and now she's got a hole in her bladder and she's leaking all the time. This woman was up near Fort Portal. And I'll never forget meeting her, thinking, here's this poor woman carrying a bucket around her whole life. 2 million women worldwide with fistulas. Again, no one hears about them. They're not the airplane that went down. They're not a pandemic that's hit the world, but they're quiet actors. And so we need to be loud for these mothers. How about the idea? Well, the idea is, do we actually agree on what we need to do to solve the issue? Do we actually know what we need to do to save mothers? I mean, arguably we do. We have all the treatments. The challenges, as some of you have shared, is how do we get them to women? So again, we need to work harder and harder at making sure we understand how do we actually get care to all women. We think about the political context of things. It affects how an issue is seen, isn't it? Certainly, again, with the pandemic, it rose to every politician's top of their box is how do we deal with the pandemic? You see it on everywhere, you know, COVID-19 issues. But when we think about the political context around safe motherhood, back in the 1990s, Dr. Merriam and I will share with you, nobody paid attention to safe motherhood. Like Dr. Merriam and I were up in Chiboga together and you couldn't get anybody's attention to talk about safe motherhood. And then all of a sudden it started to get some attention, didn't it? With the Millennium Development Goals, people started to pay a little bit more attention. But what does happen after a while? Well, people just sort of fold their arms and sometimes forget. And so we need to remember to keep that political context. And we're so grateful for people like Honorable Sylvia, who have again played an important role in the political context here in Uganda to make sure safe motherhood is on the top of the agenda. But we need to keep doing that. We need to keep that stirring the pot for mothers. And finally, the issue characteristics. So can we actually measure what's going on? Are we able to provide the interventions that are needed? And how severe is the impact? You know, there's certain things that people don't really pay attention to, but you know what? Mothers and babies dying, that is something that we should really be paying attention to. So how do we bring change? I wish, Peter, I had a picture of a chicken in that person's hand. Because what's in our hands? We all have to ask, what is in our hands? And for those people out in your village and in your area, it was a chicken, right? But for us, we have influence. All of us have influence where we are, and we can keep speaking for safe motherhood. When I'm back in Canada, again, what is my role? What can I do? I can speak. Wherever you are, you can speak, and we need to continue to keep doing that. Encouraging other people to get involved with the Save the Mothers program. You know, the program is going to be starting again, Dr. Edward. We need new candidates. We need new people to come and join the program. You guys have all graduated and we're just cheering you on. We're so excited, but we need more people coming, both here from Uganda as well as from other countries in the East African area and beyond. So again, encouraging others is so important. Some of you may want to get involved with the Mother Baby Friendly Hospital Initiative. If you're interested, Topi's going to post some information about how to do that. So please make sure that you get involved with that with your local hospital. And finally, faithful prayer and support for safe motherhood. Again, we just need to continue to keep bringing this before God. Say, God, how do we improve safe motherhood here in our communities? So in summary, the world has changed, but the world hasn't changed since the pandemic. Mothers and newborns still need and deserve care. They need good care. There's new opportunities and there's new challenges. And so we as pillar people need to understand what those challenges are and how do we address them. And let us be pillar people, people who are reliable and visible, using our hands and our strength to support vulnerable mothers and newborns. You know, I bring up this picture here because it is such an example of how people's influence goes way beyond their own little world. Here's a picture of our own dear Virginia Plan, who owns a school and runs a school that's close to here, right here. Where's Virginia? There's Virginia. Sorry, I look at Virginia. I won't put the pointer at you there, Virginia. Virginia, she turned her school into a safe motherhood machine. Like, I don't have any other description for it. She had these little kids, they've been up here singing and dancing in front of the First Lady so many times. And you think over the last, 17 years, Virginia, since you've done that, every year graduating 300 kids, whatever you have, 17 times 300. Think about the hundreds and hundreds and hundreds of children that she has put through her school. And these kids aren't educated a little bit about Save the Mothers and Safe Motherhood. They are educated a lot. And to hear their poems and their songs, like I would sit there in the audience, Mary, like you, and I would literally cry listening to these little kids talking about safe motherhood. I'm sorry, there is no child in Canada that has ever thought about their mother dying of a pregnancy-related complication. They have never, ever thought of it. And yet here's these little kids talking about it, singing about it here in Mukono. The reason I put this picture up is here's Virginia speaking to this member of parliament, this Canadian member of parliament, Charlton. She actually lives very close and worked very close to where I live in Hamilton as a member of parliament. Now, why was this Canadian member of parliament over at Virginia's school? Well, because there was a group of members of parliament, including our own Honorable Sylvia Sinabulia and others, that had rallied and asked for the Interparliamentary Union meeting to be held here in Uganda. And what was the theme of that IPU? I think what year was it, Sylvia? 2015, was it? Or 2013? I forget what it's 20. Anyways, there was over 120 parliaments from around the world had sent people here to Uganda learning about safe motherhood. And here's this Canadian member of parliament who had come over. She didn't know me. She'd never met me, never heard of me before. She had come over here to learn about safe motherhood from our own influence, our own game changers. What an incredible story of how these women have had an impact. These graduates of Save the Mothers have had an impact around the world. So I just want to encourage you. You might think you've just sowed a little seed, but God can use that and grow a huge, huge tree. So Pillar people, thank you for taking the steps to deliver that change for mothers and babies. So excited to see each one of you here today. Thank you for coming. Thank you to the people online for joining us. And may we be Pillar people, being strong, being visible, being reliable, and making an impact for mothers and babies. I thank you.
Colleagues, I'm going to ask Dr. Miriam to take the seat, and I'm kindly going to ask our pioneers, Honorable Sylvia Sinabulia and Child Health. So I'll ask our board chair and Dr. Jean to go and welcome Dr. Jessica Sungwa, who is a commissioner, and escort her to the front. We fully understand Mukono and the jam. Colleagues, why don't we give an applause to our commissioner who's done her very best to be here today. So our commissioner, we are really delighted to have you this afternoon. And I think Miriam will just take you to the front and you do the last station. And Honorable Sylvia, do you want to join the team? And I don't know how many chairs are there, Dr. Mukoza or Dr. Jean? Yeah. So I think our dear commissioner is just in time to do the bit of the session, but you are very welcome. I know how very passionate you were in issues relating to maternal newborn health. And I think like Dr. Edwards said, I can confidently say that I know that Dr. Jessica is one of the people who have given her time, her life, her family, her everything to issues relating maternal child health and safe motherhood indeed. So Dr. Miriam, I think I'm going to hand over to you to, you know, Dr. Jessica, we have to, Dr. Miriam has to really make sure you're comfortable and we, yeah, allow you to, yeah, Dr. Miriam.
Okay, thank you very much, Dr. Eve. And on behalf of the group here, Save the Mothers, the board, the faculty, and the alumni, want to welcome you, Dr. Jessica Nsungwa Sabiti, who is here today as our guest of honor from the Ministry of Health. She is the commissioner in charge of maternal and child health. She'll tell us more about her title because it keeps being updated. But we're very glad to have you with us, Jessica. You're most welcome.
Good afternoon, everybody. First of all, I'd like to apologize. I didn't know that children were breaking off today because I thought they broke off last week. There's a lot of jam along the way, but I'm so glad I'm here finally. And I'm so glad to see you all. People I have not seen for a long time, my former boss there. I'm so glad to see you here. But today is a very special day today because this is the day when we also hold our partnership for maternal newborn child health. Our technical working group sits today. And every 3 months, we have an expanded meetings. We had a very big meeting this morning, very exciting meeting this morning. And a lot of the things we're discussing actually have to do with this meeting here. I'm so glad to be here. Last year I was here and I'm so glad to see again a big number of people here. We in the Ministry of Health, we are at a stage where we have just developed our new plan. It's fresh from the press, but also we are moving from an approach of working as a sector, but working as the program. So we don't have Ministry of Health anymore. We have a program called Human Capital Development. And this Human Capital Development combines Ministry of Education, Ministry of Gender, and Ministry of Health. So we're discussing this issue. And the best thing about Human Capital Development is that if you look at those giant Asian countries, they invested in human capital development. Having a skilled, productive population. To have development in a country, you need to think about it, and you need to think about very early, from childhood, from pregnancy, because if you look at the children, between the age of 0 and 3 years, the brain is about 80% developed. So for the rest of the time, you're only working on 20% of the brain. So we're critically looking at what we can do to ensure that we have a learned, productive, and functional society. So a lot of the things which are going to happen in the human capital development are actually hinged on the work we do. So we'd like to have more people who can actually pass on knowledge, people who understand the perspectives, including looking beyond health, but also looking at people, not only for the sake of surviving, but we need people who have a well-being. We need to have even the older people to be functional and independent and mobile. So that means we have to think very differently. To do this, we need to know how we can make, first of all, mothers safe. So it starts from preconception, I know, but the importance of safe motherhood now is the center of this whole human capital development in this country. This is going to be a long plan. I think now we're working towards targets of 2060. So a lot of work is going to be hinged around thinking about this mother who's going to conceive at some time and who's going to carry a child, but also is going to nurture a child to become productive, including nurturing young people, adolescents. So, and unfortunately, our country is a very young country. We have a balloon population. So again, we need to think about harnessing the demographic dividend. We need to make sure that the young people are made productive. So a lot of what is going to happen will depend on how many champions we have, how many people can actually understand these issues, how many people can translate this information, but also how many people can be in the society to ensure that there's cohesion. So the work you've been doing here is very central to us. And that's why I'm very glad to be here. I hope you had a very nice day, very productive day. We in the Ministry of Health would like to commit ourselves to supporting this kind of interventions. We are going to work towards strengthening our collaboration with the learning schools, the learning institutions. And actually the head of our program on human capital development is the Minister of Education. because learning is very central. Learning is very central in this whole process. You might have money, you might develop infrastructure, but if you don't have a productive community in the future, all that production will go down. So we are going to be hinged around learning. We are running programs on early child development, programs on young people, programs on reproductive health and maternal health, but also we are running programs on healthy aging. So our department now has been expanded and we are also addressing healthy aging because of that reason. So we're going to be looking at the whole life cycle. We'll be thinking about the old people right from the beginning, how they are growing up, how they are conceived, and the effects of what happens before at that stage. So I'm very excited to be here. And we look forward to working with you closely. I'm so happy to see everybody here. And we really want to thank you. I want to thank my colleagues. Fortunately, these two people are my classmates, both of them. Can you believe it? And one of them was my roommate. Can you believe it? So I'm so glad to be here and to be affiliated with this function. And I think I can stop there for now and wish you a nice evening. And sincerely commit that we are going to engage more, but we have to have a mindset change. We're not going to think about learning, we're going to think about long-term benefits, but it begins from equipping people with knowledge, capacitating them, making them more productive, empowering them. And the center of this whole thing is around a mother, parenting and motherhood. So safe motherhood. And I hope that this program can be expanded and if possible, to have regional centers so that we can actually train more people and have better leaders in this field. So thank you very much. I forgot to mention, I bring greetings from Dr. Sentumwe. She could not make it. I was with her this morning.
So much. And I think the alumni, you can see the power of education. When the commissioner says, oh, these were actually my classmates. So we went to the alumni of UCU in Save the Mothers. This is our prayer and dream for you, that you really take lead as lawyers, as teachers, as journalists, as politicians, and as health workers in issues of safe motherhood. So I'm kindly going to request Dean to take over the last session. We have our ambassador, who is an alumni. So alumni, clap for yourselves. The ambassador in Washington, is a Save the Mothers alumni, so that's really great. So I'm kindly going to request that you do the way forward. So you'll do the way forward and kindly request our ambassador. She's virtual, she's online, she's in Washington, I think. So. Over to you.
Thank you very much, Dr. Eve. And thank you very much, Dr. Jessica. I was going to say that before, but I thought it would take up a lot of time, that we were classmates with Jessica and Dr. Edward and Dr. Mlindwa, who's the Director of Medical Services. And the other day we were talking with Dr. Mkoza that we've made 40 years of acquaintance. And yes, Jessica and I were roommates at campus. So I'm really honored that we still have this friendship up to today. It's not a simple, I don't take it for granted. But as I was listening to Dr. Jean, I remembered also how we met in Chiboga. She was indeed a young girl, and I was wondering, what's this Muzungu doing here? It was my first time to go to Chiboga. That lovely tarmac road going to Hoima was not there. It was Maram. It would take you 4 hours to move from Kampala just to reach Chiboga. So there I found Dr. Jean, and I was very impressed. And I'm not surprised that she continues to be an advocate for maternal health up to today. So this afternoon, honorable guest of honor, and all protocol observed, we've been discussing with the alumni, those who have gone through the program of MPHL, and they've been telling us the stories, the accounts of what they've been doing with their time and the knowledge they garnered from the MPHL program, and it's really tremendous. What I gathered is that everybody is having an impact where they are. Our challenge is, and maybe as you would have noticed also in the Ministry of Health, there are many pilot programs going on everywhere, doing very well, but each on its own. I think we need to come together as an association so that we have more, we strengthen our network. We strengthen our network, and maybe that association can be called Save the Mothers Association. And we can even work together with grants and support each other wherever you are. But like Dr. Jean gave that story of a plane crash, it makes news. But the reason why we're not making news is because we are scattered. The maternal deaths are scattered all over. Some in Chiboga, some in Kamuli, others in Buyende. It's not enough news, but if we're working together and we can have these reports have an impact, we'll be able to raise a voice for maternal health. And as the ministry is working with building capacity, Dr. Jessica, you have a great workforce here. I can see that you have adopted a multi-sectoral approach. All these people, I think maybe 1% are medical workers, but they have a heart for maternal health. They've gone through the program, and when you hear their stories, they're supporting someone sitting on the health unit management committee, and they have this knowledge that drives their passion. Others are in NGOs. We have alumni in Congo who are always shocking me with their stories. They're working with churches, they're building hospitals. It's just amazing. And when you hear the stories from Tanzania, you can see that we have a big network. This network should become an association and maybe an organization that can have a big footprint in reducing maternal mortality. So when I look around, I see there's great potential. Albert as the town clerk, you have a town clerk who's very savvy about maternal health. You can't fool him. He can take the DHO to task. So that's what we need, and that's what we have. But we're a bit scattered. We're not well connected. We come together once a year. We have groundnuts and popcorn. We eat dinner and we go away. So I'm throwing this challenge to the board that you can create an association, Save the Mothers East Africa. East Africa, because there's a very active group in the Congo. They just need to be connected, linked up with. And when we have this network of alumni, we can really have many footprints that leave impact around the nations. But that said, going back to what Dr. Jean mentioned about pillars of safe motherhood or maternal health, there are many challenges as you hold up maternal health. And we saw the challenge of COVID. There's nothing we could do with a lockdown. We see the challenge of the human resource for health. When we were growing up in our practice, it was unheard of for doctors to strike. But now you can see, I've been thinking, I think really these people are tired. They are fatigued. They need to be reassured that they're important, but they need to be given a break too. Like when I think back my own walk through my medical profession, for many years I worked in the clinic, then I went into programs, then I came to academia. But it was because I got tired of the clinic. I felt like women were dying. It seems like I'm not doing anything. What's happening out there? Then you come into programs and you find a whole new kettle of fish. The first delay, the second delay, you don't know how to handle it. It's like a big elephant. But it was because I got tired of the clinics first. So I'm thinking the workforce, as we're building capacity, there are so many other, we need to think of a way to support service providers when they get fatigued. Where do they de-stress from? Are we waiting for them to become Butabika cases? And we know as we were growing up, as we were learning in the medical school, some of our colleagues were using morphine to relieve their stress. So I'm excited that now that is the focus, capacity building, but we need to also consider the individual and look at the resources we have far and beyond. All these people are working at different levels of care, different political levels, socioeconomic levels, and they can support our health workers willingly. So I think I also heard about mentorship, again from Albert. They're getting a group coming in from Hampshire to mentor. I was thinking, oh, I have a group of nurses here who can come to Chiboga, to Kagadi. We should also build a force to mentor each other, to encourage each other. When I was running programs and I'd go to the districts, I'd really wonder, how do people survive here? Who's encouraging them? There's so many forces, political, economic. You heard Edith's story where nurses didn't have accommodation. Those are some of the frustrations. But if we have a network to encourage each other, we can do it together, we can go through these challenges. So once again, I think this is a good thing that we've come together. Let's keep this going strong. Let's build it to another level. Let it not just be a place where we come together once a year. Let's be able to come to Oyam and see what is Peter doing out there. Is it adding up? Go to Luengo, where Edith has transformed. She could mentor people from Oyam. Last year, I went with Topi and the team of Save the Mothers. Was it last year that we went to Amuru, or this year? Last year. Oh, there's a lady, there's a midwife. Is she a midwife? Is she a doctor? I don't know. There's a lady out there who has a health center, 3. And she's reaching into the community. She has like 4 or 5 ambulances, these motorcycle ambulances, where she reaches into the community and picks the mothers and after they've delivered. And she has a health center where she's providing birthing positions as you wish. And she has many, many mothers coming to her. But she also has master's students coming to her clinic to learn from her. How do you communicate with her? How do you connect with the community? But what floored us is that the community in Amur, remember, they had 20 years of war. And when you go, you actually don't see any development as such, but they raised 20 million shillings as their contribution to her work. The community of Amur. And this is a community we know, they really have nothing, but they recognized that her work was significant. And when she went to them, they raised 20 million shillings. So as Dr. Jean was saying, it's the way we talk to the community. She's a Spanish lady. Was she Spanish or Moroccan? I couldn't quite. Moroccan. Hey, so I said, what's a Moroccan doing here? Doing such a good job, convincing the community that they can even part with 20 million shillings. And I felt this is the way we should be going, to be able to connect with the community that they can invest in what we are doing too, as we give back with our technical know-how. So I've said many things. I hope it hasn't confused you, but this is the way we need to go. Harness what is in the community, but take to them the technical know-how that we have. But build a network of alumni so that we can have a big impact. So I know I'm between you and dinner, but I'd like to take this opportunity to invite Her Excellency, Ambassador Robika Konge. You're welcome to this conference of alumni, and we'll be glad to hear from you. You're most welcome. Thank you.
Hello?
Yes, we can hear you.
Oh, perfect, perfect. That would have been a nightmare if you couldn't hear me. I just first of all want to thank STM for giving me this opportunity to share this time with you. And I also want to thank God for allowing us to spend this time together. So distinguished guests, ladies and gentlemen, all protocol observed. I bring you warm greetings from the Embassy of Uganda in Washington, D.C. I'm honored to address you today as we wrap up this dialogue on re-imaging safe motherhood, the role of Save the Mothers. I'm a proud Master of Public Health Leadership alum, Save the Mothers program, Uganda Christian University. The work shared today by MPHL alumni displays steady efforts towards positive change in safe motherhood through multidisciplinary professionals. The COVID-19 pandemic has had a significant impact on maternal health care, resulting in reduced access to services and increased maternal morbidity and mortality rates. Let's recognize the importance of ensuring that safe motherhood remains a priority in our national development agenda. And again, like Dr. Jean says, let's also keep remembering to remain pillars that are strong and pillars that can hold up to what it is that we signed up for in terms of saving mothers and contributing to our communities. The Embassy of Uganda in Washington, D.C. is accredited to the U.S. for promotion of bilateral relations in political, security, economic, social, and cultural fields. The embassy also coordinates programs for the development of Uganda, and to this, maternal and child health is vital because maternal health is not just a health issue, but a social and economic issue that requires a multi-sectoral approach to achieve meaningful change. As the ambassador, I am also a non-resident ambassador to several other countries. For example, Brazil, Argentina, Mexico, Costa Rica, Jamaica. So in all these, there are many opportunities to partner and look for solutions jointly. In Uganda, we've made significant progress in reducing maternal mortality, but we still have a long ways to go. Let us recommit to ensuring that mothers have access to quality maternal health care services. We must invest in innovative solutions to enhance the quality of care and increase access to maternal health care services in both rural and urban areas. We must also address cultural and socioeconomic barriers that prevent women from accessing maternal health care services. It is important to recognize and leverage technology to improve access to maternal health care services. To this end, as we've just heard in terms of having an opportunity to create an association. I'm actually not in DC at the moment. I'm in Philadelphia, and I had been invited to a conference called the General Health Catalysts. And this conference brings all sorts of experts in the public health arena, and it's called the Global Health Catalyst Summit. And for example, when I was there, I was also given a chance to speak as the ambassador, and there are many initiatives that they would like us to do. They're interested in committing to training, they're interested in committing to creating awareness in public health, and they're also committed to making sure that there's some sort of communication on key areas in health. And these collaborations involve University of Penn State, Johns Hopkins, and Harvard, among other institutions. And also they're looking at working with the Uganda Cancer Institute. So as Dr. Merriman has mentioned, the opportunities are many. And just being at the embassy, each week I get no less than 2 requests related to health and public health. And people want to know, how can they partner? How can they be part of this conversation? And quite frankly, sometimes I reach out, many times I've reached out to Topi, but I just feel like if we had some sort of maybe committee or for projects or things along that line, there'd be a better flow. So I really do welcome that opportunity to form an association or to even meet like on a more regular basis. And if you compare Uganda, we're 45 million, but America's got like 400 million people. So like it has all these there are all these pieces and all these elements that if we were to put our foot forward, we can definitely tap into, even if we were just to get volunteers to come to Uganda, or like even students and residencies. The opportunities are many. It's just on our side that we really need to see how better we can coordinate to take advantage of these opportunities. Okay, now let me go back to to the speech that I'm supposed to read. So thank you, Save the Mothers. I know Safe Motherhood stakeholders for your commitment to improving maternal health care. I invite all stakeholders, including the government, civil society, private sector, and development partners, to keep safe motherhood conversations alive and ensure access to quality maternal health care. Thank you for God and my country.
Thank you, Excellency. We are grateful that you could give us your time, and we are glad to hear there's opportunity out there. We shall get in touch with you. And I'd like to hand over to I'd like to ask our chair, the board, Honorable Sylvia Sinapulia, who's also an alumni, to come and give our closing comments and close, and say a prayer for the dinner and show us the way.
Yes, thank you very much, Dr. Miriam, our guest speaker, Dr. Nsungwa Jessica, the ED, Dr. Mkoza, Dr. Jean, the founding director, colleagues, the alumni over the years, ladies and gentlemen, good evening. I don't want to stand between dinner and you, so I'm going to be very, very brief, because I've been asked to give some closing remarks, and really they are going to be thank you words, beginning with the organizers of this conference. Thank you so much for, I know there's a lot that you've put in over the month. Thank you, Topi, for the communication, the reminders, reaching out to all the alumni. Thank you for not giving up. Thank you, Dr. Mkoza, as the executive director. I know you've been giving a lot of support to the organizing team to ensure that this happens. Thank you, Dr. Jean, for traveling all the way to be part of this, and for the keynote speech which you gave, reminding us, I don't know whether you're reminding us or whether you're baptizing us that we are pillars. Initially, you talked about game changers. Now you've added on the term pillars. And indeed, wherever we are in different parts of this country and in the region, we are pillars for safe motherhood. So we want to thank the alumni, those of you who have made presentations today, both oral presentations and the pictures. I came in a bit late, but I think before I go, I'll go around and look at the pictures and see the stories you've shared. But we thank you so much. I've seen the actualization of the vision of the Save the Mothers, because when Dr. Jean and the team started or thought about starting this program, it was about bringing out professionals on board. I remember I was part of the group of 2005, the first group. And I remember people asking us, what do non-health professionals, what do you have to do with safe motherhood? So it has been a long story, but I believe now when you see the commissioner coming here today, it's a manifestation of the confidence the ministry and all the players have in the Save the Mothers program. And we want to thank you so much for this trust, for the confidence, and for the support which you bring on board. It energizes the alumni, it makes us reflect. And right, like Dr. Miriam said, you know, when we are scattered, we kind of fall back into the different things we are doing. But when we come together annually to see what we are doing, to share these experiences, it energizes us and it makes us stronger. And the proposal to the board to support the formation of the building of a network, because we have the network is there, it's kind of loose. We have a WhatsApp group and active members share experiences and chat. But I think we now want to take it to another level, to register, to build it, to register it. And I am tasking Dr. Mukoza to put it as an agenda item to our next board meeting, which is Friday next week, such that we can see what is required to have it actualized, built and registered. So I want to thank you so much. I want to thank everyone who has been here today. I know we don't take it for granted that you left whatever you're supposed to do and you came for this conference. I want to thank the board members around, Pastor Josephine and Margaret. You're representing all the other board members who have not been able to be here. Thank you very much for coming and supporting the alumni. I know you're alumni in your own capacity, but when you come, still it motivates the alumni. So thank you very much. We look forward to converging next year, and I believe we'll have more presentations and stories to share. Thank you very much, and God bless you all. Okay. Yes. By the I'm sorry, I have to recognize a colleague here, Dr. Twatwa. We were together in Parliament, in one of the parliaments. You know, me, I was there for quite a number of years. I was there 3 times. Dr. Twatwa was there once or twice. Sanja Chimio. Okay, but I'm glad that you are here with us. I hope you've enjoyed the evening. May I, where is the Reverend? Okay, I'm a daughter of a Reverend, so I can pray. Let us humble ourselves and pray. Our loving Father, I want to thank you for this time. I want to thank you for this day. This is a day that you've made, and I want to thank you for each one of us. I want to thank you for this wonderful program of Save the Mothers, which has been with us here for 18 years. 18 years looks so big, and yet when we look back, it's like it was yesterday. I want to thank you for the founders of this program, Dr. Jean, who is here with us, and those who are not here with us. We thank you for their vision, and we want to thank you for all the alumni and all the faculty and all the people who have supported this program over the years. We thank you for this particular event we've held today, and we thank you that you've enabled it to be successful, carried on up to the end. And now, God our Father, we have a meal prepared before us. We thank you for the resources and the hands that prepared it. And as we go to partake it, we pray that you bless it so that it can give us strength to still carry out the work which you entrusted us. of saving the mothers and babies of this country and the region. I pray all this in the name of Jesus Christ, our Lord and Savior.